This lecture is going to focus on the types of evaluation and specifically how those types of evaluation can help programs determine how to improve themselves for future evaluation efforts and program services. I want to revisit the definition of program evaluation as a reminder and to set the stage for what we will be talking about around the different types of evaluation. If you'll remember, program evaluation is a system by which we can collect information about program activities, characteristics of our clients, and also the outcomes of a program in order to help us make judgments about that program. Much of this can be around how to improve the program's effectiveness or inform decisions about future programming. It also will help to answer the question of what happened as a result of this particular strategy that would not have happened in its absence. The first type of program evaluation is formative evaluation. This is a form of evaluation that really helps administrators and program managers monitor their program. It helps to focus on a way of improving or enhancing a program, but it's not going to determine the actual effectiveness of an overall program. This is more of an open-ended approach that happens typically when you're trying to start a program or implement a program so that you can gather information about what is working very well and where there might be some challenges. Oftentimes, the formative evaluation will help to raise flags for training needs for staff and also efforts towards recruiting and maintaining clients within a program. This is more of an improvement-oriented approach. The summative evaluation can be thought of as an overall project or program evaluation. Typically, that will happen at the end of services and will be able to determine the overall effectiveness of a program. And it's usually going to be helpful in helping administrators, executive directors, supervisors to make decisions about continuing or terminating. Whether it's an experimental or pilot project, it can help determine whether or not it would be useful to seek further funding and maintain that project. So it will help to provide data that supports making a decision about a program's worth and whether or not it is worth continuing that program. So again, this will primarily be used by program administrators or at the higher level leadership at an agency. This type of evaluation is more of a judgment-oriented approach. Process evaluation is similar to formative evaluation in that it is going to help us look at the implementation of our program. In process evaluation, what we are typically doing is going back and counting how much service has been given and whether or not we reached the audience that we intended to reach. Think of this as the type of data you would collect around the numbers of clients that you're serving or the number of trainings that are being given. This is more of a count, again, about the units of service. You might also use this with staff to see whether or not they're developing relationships, networking, collaborating, attending meetings. This will not tell you anything about the change or the outcomes for the clients, but it will tell you how you are doing around implementing the program services. Formative and process evaluations can be thought of as related. The main difference between a formative and a process evaluation is that a formative evaluation is going to be looking at consistently monitoring and looking for areas of improvement in service delivery. Process evaluation is just going to help you measure whether or not you're implementing services the way that you intended to. The outcomes evaluation can be thought to align well with a summative evaluation. Since a summative evaluation is looking at the overall effectiveness of a program, it is similar to an outcomes evaluation, which is looking at the progress or the impact that services had. Typically, when we conduct an outcomes evaluation, we're trying to see whether we were able to impact the client around one of 5 areas: their knowledge, their attitudes, their beliefs, their behaviors, or their condition. In the evaluation project that you will be doing in this class, we will be focusing more towards an outcomes evaluation. You will be designing an intervention whereby you want to influence the knowledge, the attitude, or perhaps the behavior of your fellow students. We are probably going to stay away from beliefs and conditions, since this is a very shortened version of an outcomes evaluation. Knowledge is generally easier to impact in the short term. You can give somebody new knowledge and then measure whether or not that knowledge has maintained in a shorter period of time. The same can be said about attitudes, although attitudes can change over time. And you can also influence behaviors in a shorter time period. For example, if you're giving information on how to eat or implement healthier foods into their diet, that is a behavior that you could measure across a shorter time span. Now, it may not sustain in the long term, but it's certainly something that, if given an effective intervention, your peers might actually change their behavior around your topic. Indicators are a specific kind of data that are used to help us track progress toward achieving goals. An indicator is something that is going to be able to be observed, measured, and tracked over time. Different levels of outcomes make it necessary to measure the impact of services on the client, the programs, the agency, and the community. We've talked about different levels of evaluation. We evaluate clients at the individual level. For example, we might see and try to determine whether or not their parenting involvement improves through our intervention of parenting education. Along the area of program evaluation, our hope is to be able to measure a change in the effect our program has on the ability to reunify families who may have had an incidence of substantiated abuse. We want to, over time, see that family reunified and stabilized. That would be a program level evaluation, the effect on family reunification, but that is greatly dependent on the client and whether or not we've been able to influence parental involvement in a positive way. At the agency level might look at family reunification over time. For example, how many families maintain in a stably housed environment without any more removal into CPS. Family reunification would be an indicator that over time, our agency, through the program and our work with clients at the individual level, has been able to influence positive and healthy functioning families that have less interaction in the social services system. At the community level, we might look at something like the total population in out-of-home care as an indicator of whether or not our agency is running a successful program that is benefiting parents who are now interacting with their children in a positive way, thereby reducing the number of child abuse allegations, thereby reducing the number of children removed from the home, thereby reducing the number of children in out-of-home care at the community level. So again, an indicator is a specific kind of data that helps us track progress towards goals. The final project that you are working on throughout the semester, again, requires you to think about what it is in the short term you might be able to influence for your peers. You probably want to focus on a topic that is a little bit easier to influence across knowledge, attitude, or behavior. We'll talk more about this in future lectures.